Yes, my name is Katie Baker, and I am the Virginia State Director for Protect Our Care. We are a national advocacy organization whose mission is to strengthen and protect healthcare. And we do so largely through events like this one, at which we engage and educate press and the public about the most pressing healthcare issues of our time. And we are honored to be joined today by the two chairs of our state legislative health committees, Chair Favola and Chair Willett, as well as our friends from TCI and rural Virginians from all different parts of the Commonwealth to discuss this very alarming report that just came out from the Joint Commission on Healthcare showing that 13 of Virginia's rural hospitals are at risk of closure. That is more than a third of Virginia's rural hospitals are at risk of closure. And this news is coming as we approach the 1 year anniversary of the so-called One Big Beautiful Bill Act, which we at Protect Our Care just call the Big Ugly Law, because that's what it is. It will result in hundreds of thousands of Virginians losing their health care due to cuts in Medicaid and the Affordable Care Act, and all to fund tax breaks for the very wealthiest Virginians. And with no further ado, I am going to keep this call moving along today because we have quite a few wonderful speakers. I'm going to turn it over to the chair of the Senate Education and Health Committee, Senator Favola.
Thank you, Katie, and thank you for pulling together these wonderful speakers and this important topic. It certainly merits a lot of attention. Delegate Willett and I, as you know, serve on the Joint Commission on Healthcare. I chair that body this year, and we did receive an informational briefing on the impact of HR1 on our rural hospitals in Virginia. And we have in Virginia 36 rural hospitals. The report tells us that 13 of those hospitals are at risk of closing, or they're at risk of closing important inpatient services, such as a maternal and child health unit, obstetric care that would be provided in that maternal child health unit, delivery, postpartum care, all of those services. And then it's as you go down the list, we've got hospitals that may not be providing cardiac services for individuals that may suffer a heart attack. There are a number of inpatient services you receive at a hospital that are life-saving and need to be received in a timely manner. And that was the most alarming conclusion of the report that we received. Now, let me just say that for many years, our rural hospitals have been living on the edge. They have a very higher percentage of patients on Medicaid, and especially on the Medicaid expansion program, than perhaps hospitals in other parts of our state. The federal reimbursements have been shifting quite a bit. So they've always been living on the edge, if you don't mind my saying that. But with the HR1 kicking in, the expectation by the Virginia Health and Hospital Association is our hospitals across Virginia will lose about $2 billion a year. And these are the results of changes in Medicaid eligibility, changes in the expansion population, changes in the payment rates that, supplemental payments that used to be available to hospitals. A combination of things it will cause an incredible reduction in revenue to all of our hospitals. And this is going to be particularly impactful to our rural hospitals. They're already living very close to the edge in terms of being able to maintain a full range of services because of the large number of individuals who need Medicaid and Medicaid expansion to receive health care. They have a large portion of residents who are uninsured. So, at the end of the day, I keep telling people, having a robust healthcare system that keeps our population healthy is good for our economy and is good for our families. Individuals actually increase their productivity, they work longer, they're able to take care of their families better. All of these sort of good quality family life factors are enhanced when you have enough insurance when enough individuals have insurance and healthcare systems can work. So it's going to be a struggle. I will just conclude by saying that my colleague, Delegate Willett, who is working very hard uh, to sort of piece together where we can bolster some type of infrastructure. We will not be able to make up the difference in federal funding, but Virginia did receive a rural health transformational grant that we will be able to use some of those dollars to maybe bolster certain services in rural America, rural Virginia, with the expectation of perhaps providing a bit of a safety net. So I will conclude my comments there.
All right. Thank you so much, Chair Fabola. I do want to let reporters know if you have a question, feel free to go ahead and drop it into the Q&A box now, and we can accommodate some of those, if not all of those questions at the end of the call. And with that, it is always my honor to introduce my delegate, the chair of the House Health and Human Services Committee, who's a true champion of rural healthcare, Delegate Rodney Willett. Chair.
Katie, thank you so much. No, it's good to be with you. And I of course, love working with my partner in crime here at Senator Favola on the Joint Commission on Healthcare. I will say we all see a lot of reports in these positions that we hold. This is one of the most disturbing ones I've ever read. This is absolutely a crisis that we're facing in Virginia. The numbers you've already heard are stark. The report talks about up to a third of the hospitals closing. A question I asked of the Joint Commission staff, what hospitals didn't make that cut but are close to it? They're on the edge, and that's another 18 hospitals. So you could be looking at potentially that's close to 70% of the rural hospitals at risk at a high level in the Commonwealth right now. I wanted to mention some work that we did going back to 2024. Speaker Don Scott created a select committee on rural health care. I chaired that. It was a bipartisan committee. We went around Virginia to visit the rural hospitals, the health systems, talk directly to their leadership, to the providers, to patient advocates, et cetera. At that point, we were seeing what Senator Vol was describing was the cutback in inpatient services, particularly in labor and delivery. We went to multiple rural hospitals where the lights are off on that part of the hospital, that wing of the hospital. That was the part one response. We thought things were tough enough in 2024. Now look where we are. The impacts of the big ugly bill now are forcing these hospitals to look at closure. It's a situation, of course, no one wants to be in, but that's what they're being forced to see. Naming some of the hospitals, Korea and Tazewell Community Hospital. We went to that hospital in Tazewell. They're doing amazing work out there, but the math is not working. And with the changes to Medicaid, they're making it even more difficult. The hospitals are losing what little financial flexibility they have is being taken away. We saw this at Centera Halifax Regional Hospital, Bon Secours Southampton Memorial Hospital. These folks want to do the right thing and take care of these rural communities. They can only lose money but so long and not stay in business. So it's a real challenge for them. And at this point, we are once again, the speaker has reconstituted this rural healthcare committee. I'm going to chair it again. It's going to be bipartisan again. We're starting our first meeting next week, next Thursday, and we will hit the road again and go around Virginia and again try to gather information and try to gather solutions to try to help these hospitals. We've got to meet people where they are, and folks are already struggling to get care. If you close some of these hospitals, people are looking at multi-hour drives to get to a provider, and that's just not right in the Commonwealth. Katie, thank you so much.
Thank you so much, Chair. I'm glad to hear that you are again sharing that Rural Health Committee. It was my honor to travel with you on the road to Tazewell for, I believe it was your inaugural meeting of that committee as we heard the challenges that they were facing down there. And next, it's my honor to introduce a true champion of healthcare, and her organization specializes in uh, state budget analysis. Ashley Kenneth, the president of the and CEO of the Commonwealth Institute for Fiscal Analysis. Thank you so much for joining us, Ashley.
Thank you, Katie. Good afternoon, everyone. Again, my name is Ashley Kenneth. I'm the president and CEO at the Commonwealth Institute for Fiscal Analysis. TCI is a research and advocacy organization committed to advancing racial and economic justice in Virginia. This time last year, TCI was proud to join our partners at Protect Our Care and healthcare champions in the Virginia General Assembly, like Chairs Favola and Willett, in opposing HR1. Unfortunately, congressional Republicans, including every Republican in Virginia's congressional delegation, voted in favor of this federal budget bill, which includes over $1.1 trillion in cuts to healthcare spending from Medicaid and the Affordable Care Act. The cuts to Medicaid alone are the largest in the program's history, totaling over $900 million, and target people who are able to access care because we expanded Medicaid. This massive healthcare spending cut was done in order to partially fund tax handouts for billionaires and corporations. In Virginia, the richest top 1% are expected to see an average tax cut of $80,000 from new tax policies and extending some TCJA provisions. Meanwhile, we expect people making below $31,000 a year to not only see nothing from the tax package, but also for many to see their healthcare costs go up, as Congress requires states to impose cost-sharing provisions on people eligible because of Medicaid expansion. These costs could mean the difference between seeking care and paying for groceries. At the same time, massive, profitable corporations are getting tax breaks they don't need. Just 4 technology companies, Amazon, Alphabet, Meta, and Tesla, reported a combined $51 billion in federal tax breaks for 2025, with new analysis showing much of the benefits coming from the Republican budget bill. Now, Virginia and our nation are grappling with the impacts of these healthcare cuts. The harm of HR1 will be felt beyond the estimated 350,000 people in Virginia who are expected to have their health coverage taken away. As you've already heard today, 13 rural hospitals in Virginia are at risk of closure, according to the report presented to the Joint Commission on Healthcare by the nonpartisan JCHC staff. And when rural health centers close, access to doctors and critical services are cut off for whole communities. Additionally, we know that when some of the few healthcare facilities in a community close, or people are kicked off of their health insurance, people turn to other limited options, like federally qualified health centers and free clinics. That is why we are thankful for Chairs Favola and Willett for fighting to keep funding in the budget to support our free and charitable clinics, who will shoulder the impact of more people becoming uninsured. We are committed to fighting alongside you to mitigate the impacts of the federal Republican budget and working together to make healthcare more affordable and accessible to all. Thank you.
And thank you so much, Ashley. And I do just want to name TCI. We have been fighting for months. You've been a great partner to Protect Our Care before that passage a year ago of that big ugly law. And we definitely put up a valiant effort, but unfortunately, it's, as you mentioned, it's every Republican in Virginia's congressional delegation voted for those cuts. That includes my congressman, Rob Whitman, who represents a district that has one of those hospitals that's at immediate risk of closure in Tappahannock. And our next storyteller, Celeste Garrett, That's the nearest hospital to her. She actually came with us to do an event with Planned Parenthood up in Tappahannock to sound the alarm on the threat to that hospital a month or two ago. And Celeste, it's my pleasure to turn it over to you.
Thank you, Katie. Yeah, as Katie just stated, Rob Whitman, who is up for re-election, definitely did vote for this hospital closure that we're looking at. I've lived in King William County for 14 years, and the nearest hospital to me is VCU Tappahannock. It used to be called Riverside, and I was really excited about 5 years ago when I saw that it became VCU, because as you guys know, VCU is state of the art, top of the line. I now have a primary care physician who is right in King William County, associated with VCU. So it's not just the hospital that I'm worried about. I'm also worried about losing my family doctor. Myself and my son go to see her, and she's just down the road, which is amazing for when you live out in the middle of nowhere, kind of like I do. Tappahannock, VCU Tappahannock, it takes me about 20 minutes to get there. And they have an emergency room, and they have just about anything you could possibly need to go to a hospital for, all except for trauma. And the nearest trauma, as well as now, if this hospital is closed, the nearest trauma center would be VCU in Richmond for me. And that takes about an hour to get to, assuming that I don't hit any kind of traffic. So we're looking at a difference, basically tripling travel time if I need to go to a hospital. And I'm pretty concerned about that. And I talk to people out here about it. A lot of people out here in King William don't even know that it's happening. So I think there's a lot of people out here who maybe did vote for Rob Whitman or maybe planning to vote for him again that aren't aware of the fact that he really sold us out here. And we have yet to feel the pain of it, but it's coming.
All right. Thank you so much, Celeste, and thank you for traveling with us to Tappahannock. I do want to remind reporters, because we had a question about this, the Q&A box is separate from the chat. So only panelists can use the chat, but if you are uh, a webinar participant, you should be able to drop a question in the Q&A chat, which we will field after all our speakers. And our next speaker is a rural healthcare storyteller who has been a good friend of mine for several years, and that's Miss Celine Montgomery from Brunswick County.
I had to take myself off mute. Thanks so much for having me. And as Katie said, I'm Celine Montgomery and I live in Brunswick County and I'm very engaged with my community. I go to VCU Hospital in South Hill, which has made the list for being at risk of closure. And on a personal level, I'm worried how this will affect me as my doctors want me to have a shoulder replacement. I've opted not to do it right now, but if I decide to do it later, I would need to go to physical therapy in South Hill weekly. My significant other is 86 years old, and he can drive as far as South Hill, but I can assure you he can't drive as far as Richmond to get me to physical therapy. If that hospital closes, then I won't be able to get there that I know of, because transportation is a big barrier for people in rural areas. I am disabled, and driving a distance is a challenge for me sometimes. There's no Uber or Lyft where I live. And if you're not able to drive, you have to rely on friends and family to drive you. And with the gas prices the way that they are right now, that can be expensive. And so transportation is a really big issue. If South Hill Hospital closes, there are many considerations for people choosing a new hospital and not just distance. Part of why we go to VCU South Hill for an emergency is our doctors on staff there. And Brunswick County is in the middle of two at-risk hospitals, so that would be VCU and Bon Secure in Emporia. If I need to go to the hospital for an emergency in South Hill because my doctor's on staff there, then he knows us. And, that's important. He's been my doctor, that's my primary care doctor, for years. So people also have to think about whether their particular hospital system treats their insurance as in network, especially if you have Medicare Advantage. Because we're not talking so much about Medicare Advantage and not being able to access things like transportation. So if they have transportation, if people provide transportation, it's going to cost us like about $100 to pay if we don't have means of transportation to get back and forth to Richmond. I come to the senior center often, and in fact, I'm at the senior center right now, and people are scared. And one of the things that I say to them when they say this to me is, I'm scared too. The system's already confusing, and we don't know what's going to happen. And so I would just like for the Republicans that passed this big, ugly law to come see senior centers and the communities and tell us that tell us to our face that they would risk shutting down hospitals in order to fund tax breaks for billionaires. And I thank you for your time. I appreciate your work that Senator Favela and Delegate Willett are doing. And yeah, I'd like to invite you to our rural hospitals in Emporia and in Mecklenburg.
Come see you.
Wonderful. Thank you. Thank you, Miss Celine. And, I know that I believe you live kind of on the line between the fourth and the fifth district, if I remember right, Celine. But that South Hill Hospital is in John McGuire's district, Congressman McGuire's district. And he really does deserve to be held accountable for putting hospitals in his district at risk of closure. Because we have heard how important that is for you to have that hospital in your neighboring county there. And next, we will have our final storyteller, Miss Penny Blue, who can speak from her personal experience as a rural Virginian, what it means to be able to get to a hospital quickly in an emergency. And that's really what's at stake here if these hospitals shut down, among many things, is time and not being able to get to a hospital in time. And so, Penny, I'm going to turn it over to you.
Great. Thank you, Katie, so much for inviting me to share my story today. Our previous lieutenant governor, about a year or so ago, told Virginians, quote, unquote, don't panic with regard to the healthcare cuts and possible rural hospital closures. Well, I live in rural Virginia, specifically Franklin County, and in 2021, I panicked because I suffered from a subarachnoid hemorrhage, commonly called a brain hemorrhage, or many may call it an aneurysm. And with this type of an issue and many other 911 or emergency issues, minutes matter, seconds matter. My ambulance ride to Franklin Memorial Hospital only took about 15 minutes or less. After receiving my initial treatment, I was airlifted to Roanoke Memorial Hospital. Local rural hospitals are very necessary. If there were no Franklin Memorial Hospital, it would have taken me over an hour to get to Roanoke Memorial Hospital for initial treatment. 50% of people that this happens to never make it to the hospital. Of that 50% that make it to the hospital, 1/3 don't leave the hospital not living anymore. Another 1/3 of that latter 50% leave the hospital, get to leave the hospital living, but don't leave with a satisfactory quality of life. I am very thankful and feel very blessed to live in Virginia because I'm a part of that 1/3 of the latter 50% that left the hospital with the same quality of life that I had when I went into the hospital. Minutes matter, seconds matter, rural hospitals matter. Thank you.
Thank you so much for sharing your very powerful story, Penny. And so
People matter.
yes, people
Yes.
matter.
People matter.
Senator,
Thank you.
agree with that, and so glad that you made it and that you're here with us and that you do still have that high quality of life. With that, I see several questions in the chat. We're going to try to get to as many as we can, so I'm going to turn it over to my colleague Fletcher.
Thanks, Katie, and thanks again to all of our great speakers for joining us today. The first question we have is from Charlotte Woods, and it's for Chairs Favola and Willett. While budget negotiations are still underway, a good chunk of the budget is healthcare. Any insight to be shared on resolving differences on it between the House and the Senate?
Who wants to go first on that one?
I'm going to let Delegate Willett follow me because he's going to conclude on this topic.
Yeah.
I will say that both the House and the Senate passed budgets invest in federally qualified community health centers because we know they're the providers of last resort. Both budgets invest in our free clinics. Both budgets accentuate the need for telehealth. Both budgets have money set aside to use to be used for tax credits to try to make up for the reduction or the lapse in tax credits at the federal level. So both budgets will have some pot of money to allow individuals to help offset the cost of insurance. But it's a limited pot. It's not going to go up to covering, those up to 400% of the federal poverty level. We don't have those kinds of resources. And I will just conclude, and I mentioned yesterday, individuals need to talk to candidates running for Congress this session. There need to be changes in the federal policy. HR1 would be devastating if it's to stay in place. And I think we heard these wonderful stories and they were so real and they talked about the impact on human beings if hospitals close and the impact on communities. It's just devastating, and this should not be the kind of the kind of country that we are willing to accept. So I believe healthcare should be a right.
I couldn't agree more with Senator Vola. The healthcare area is actually one area. There's great alignment between the House and the Senate. But my goodness, the hurdles we're having to clear that we've never had to clear before. We have hundreds of millions of dollars in here in our budgets, both budget versions, to deal with the Medicaid. We call it transition, trying to implement the work requirements, for example. We have hundreds of millions of dollars to pick up the administration of SNAP benefits, which we did not have to pay for before, and also the SNAP benefits themselves, because we are not going to have a perfect error rate, and we're going to have to pick up another $100 million there. So you get to the $1 billion range really fast just on stuff we didn't have to do this time last year, and that's before the worst of the big ugly bill takes effect, and you really start to see the multi-billion-dollar cuts to Medicaid.
Thank you both very much. The next question we have is for the two of you as well. So maybe Delegate Willett, we can start with you, and then we'll come back to Senator Favola on this one.
Sure.
Ballad Health has 2 hospitals on the list in Southwest Virginia, Dickinson County and Smith County. They have said that in the absence of Ballad, more hospitals would have closed in Southwest Virginia. They also say they are monitoring the situation and will advocate aggressively to preserve rural access to community hospitals. What is your response to that comment?
I've been to some of those hospitals. I've not talked to Ballad since the JCHC report came out, but they absolutely are an essential healthcare provider partner. I know the area of the state they're covering. That we did visit that with the Rural Health Committee. We'll probably go back there again. The way this works is, yes, a system like that, they are not the smallest system. They're not the largest system. They have some hospitals that are more profitable than others, and they're able to leverage where they do make money to help the hospitals that really don't break even. We visited multiple hospitals in 24, again, before all the terrible things started happening with the big ugly bill. They were already in the red and basically being propped up by other sister hospitals that were doing better. So it's a dire situation, obviously being made much worse.
I I don't have anything to add to Delegate Willett's response, but I will say that as lawmakers, we are going to monitor the predicaments of our rural hospitals very, very closely, and we will do our best to support them in any way we can. We understand that they are integral to our life care system, and they're integral to the fabric of our communities. So,
Great. Thank you both. And Senator Vovola, I'll invite you to answer this one first, and then Chair Willett will come back to you. Uh, this is from Kate Andrews. Is there a difference in state funding support for the at-risk hospitals run by VCU Health versus Carilion?
well, as you know, Medicare has had, they do have a increased reimbursement model for hospitals that are considered teaching hospitals. So, residents and those still in their medical training, if they're sort of interning or having residences in that hospital with senior physicians supervising, they do get an increase in reimbursement. Um, but I mean, again, a lot of the university systems, VCU and UVA to a large extent, they have branched out. They have satellite facilities in underserved areas, and they're trying very hard to reach individuals who otherwise would not have access to care. And so that's a really important aspect of some of our university hospital systems, and we have to ensure, I believe, that they stay vibrant and able to serve in these underserved areas.
Yeah, I could just add to that. I actually serve on the VCU Health Board, so I have a little bit of insight in terms of our budget there. VCU Health is doing several things, just as the senator mentioned. It is a teaching hospital. It's also one of the hospitals of last resort. We do not say no to anyone. We take every patient, and Korean does that as well in their area. Yeah, that's a huge burden, and the state helps as much as it can. But I can't emphasize enough, though, how much Congress, the Republican-led Congress, is tying our hands here. We have a system in place right now. It's not perfect, but with the provider tax and the state-directed benefits we're able to use right now, we've been able to keep the system working. All of that's being reduced, if not eliminated, by the big ugly bill. It's an incredible change. That's when we start getting to the multi-billion-dollar impact. And there's no way Virginia can make that up. We don't print money as a state.
Yeah, and I just wanted, it was really alarming that Congress actually put a cap on the provider tax that, Virginia hospitals were paying, that went into a fund, and then it was reallocated based on need. And it was a way of keeping many of our rural hospitals afloat. And yet now, because of the HR1, there's a cap on those supplemental payments. And it's just, we didn't ask for that. The state was doing just fine with that provider tax. The hospitals, had agreed to it. It was based on those who could afford to pay more paid, and those hospitals that were serving a higher percentage of uninsured individuals got a higher payment back. But the cap was just, it was very alarming because we were talking about money that was all within the state. We weren't talking about, federal money or the need to reduce the federal budget. So,
Yeah, they're not letting us take care of us. We were taking care of ourselves at that level, and now they've eliminated or significantly, severely reduced that ability.
right,
Yeah.
right.
Wonderful. Thank you both. And for this one, we'll of course stick with our two chairs, and then Katie or Ashley, if you want to add in, please feel free as well. Many of the hospitals listed in this report, this is coming from Kate Capodanno. Many of the hospitals listed in this report have spoken out emphasizing that this report might not fully capture their specific financial picture. Some federal legislators say this is being used as a political push from Democrats. Why is healthcare becoming a partisan issue? How can we keep the focus on the patients versus the politics?
I could jump into that.
Okay,
I could tell you
go ahead.
we were making it a partisan issue. Healthcare is one of the most bipartisan things in Virginia. You look at my Rural Health Committee, you look at Senator Favola's committee, my HHS committee. We're the most bipartisan committees you will find because we all have the same challenges. Even though there's a lot of focus today in this report on the rural areas, a lot of those same challenges, whether it's workforce, transportation issues, et cetera, those are faced across the state. So we're trying to solve these issues for everyone. And my colleagues who are representing those rural areas are mostly Republicans. We're arm in arm on this. They're asking the same tough questions that I, as a Democrat, am asking when we have folks coming to us talking about the cuts to Medicaid. I mean, they know they're going to have thousands of constituents losing health care coverage, losing access to hospitals, free clinics being overwhelmed, FQHCs being overwhelmed. It is a shared problem. So you can say what you want. This report is a very absolutely a nonpartisan report done by the Joint Commission. We all sit on that. It's Republicans, Democrats, it's bicameral.
Right.
It couldn't be less biased in that sense. The facts are the facts, and what's being done to us by Washington is unconscionable.
And I would just say this is the first step of a more in-depth study. It was an informational report. So our staff will be delving in much more detail over the next 12 months to really tell us exactly what's going on. So I think that should be context that people keep in mind. And I want to reinforce the fact, yeah, I mean, healthcare is bipartisan. I mean, we had bipartisan support when we agreed to participate in Medicaid expansion at the state level. And when we participated in Medicaid expansion, we got about $2 billion a year flowing into Virginia because of the increase in healthcare services, the ability to hire more healthcare providers, the ability to bolster the economy in some of our rural areas, and the ability to serve our working Virginians who needed insurance. So, Medicaid expansion was an incredibly positive, on many levels, was an incredibly positive program to participate in. And Virginians became healthier. It was a really good thing. So to see the trade-offs that the Republican Congress made in terms of providing tax cuts to the wealthiest 1% and taking away access to health care, taking away health care services for those who really have no other means, have no choice. They can't move out of their current jurisdictions. It was very, very discouraging.
Yeah, and Fletcher, if I could just add to that, like definitely want to echo what both of the chairs said about Medicaid expansion being bipartisan. I was worked back at the House caucus at the time we were fighting for that, and I remember that being bipartisan. But that said, to answer your question, I think that was from Kate. Like the Republicans are the one who made the big ugly law partisan. Like not a single Democrat voted for it, and almost every Republican did. And every Republican in Virginia's congressional delegation did. And not a single Democrat in Virginia's congressional delegation did. So, like the scoreboard, the roll call is what makes it partisan. So, I would ask them why they're voting to cut healthcare. And, I do appreciate that there are state legislators who are concerned, in rural areas, Republican state legislators who are concerned and maybe represent these districts that have hospitals at risk of closure. Like, we need them talking to Congressman Morgan Griffith. We need them talking to Congressman Ben Cline and Congressman John McGuire and ask them, what are you doing? And holding them to account for those votes, in order for this to be a truly bipartisan issue. But yeah, if Republicans want to come over and vote to reverse these cuts, we would welcome that. And they can make it bipartisan again. Um, Fletcher, do we have time for one more question? Or I'm sorry, Ashley, did you want to add anything to that? I didn't mean to just grab my mic with my packet.
I was just going to say that, I think it's important for us to focus on what we do know, as you all have already said. Like, we know the negative impacts of HR1. We know that people are going to lose access to care. We know that so many rural hospitals are already strained, and HR1 is only going to exacerbate the challenges that they're facing. And numbers aren't partisan, right? And so I think that we need to focus on on telling the stories, like the stories that we've already heard today from Penny and Celeste and Celine, keep talking about the impacts that are actually going to be felt by people who are on the ground. And that's how we keep the focus on where it needs to be, which is on the patients, on the people.
Thank you all so much. That is unfortunately all the time we have for now. So I'll turn it back to you, Katie.
Yes, so thank you everyone, especially to our chairs for joining us, our partners at TCI, and all our storytellers. If you're a reporter and we didn't get to your question, please follow up with me afterward, and I will see what I can do in terms of getting you a response. But again, I just want to name that we are in an all-out crisis here, and one party in Congress is responsible for that. So it's really on them to reverse these cuts. And again, thank you everyone for joining us. And with that, I will let everyone get back to your day. Thanks so much.